Let's speak to Matt Dockray now. He was discharged from hospital on Thursday after recovering from COVID-19. Matt, thank you so much for talking to us. How did it all start?
We started off with a bit of a cough. I think it's about 2.5, 3 weeks ago now. I was heading up to Wembley for the Villa Man City League Cup final. I just had a really bad sort of dry cough, bit of a headache, nothing untoward, just felt like a bit of a cold. And then day by day just got worse and worse and still felt like really bad flu. And then got to the point where after about a week and a half, 2 weeks, I literally couldn't get off the couch. Couldn't really sort of sit upright. A real hacking cough to the point where you wanted to be sick. Then you lose all sense of taste, all sense of smell, and a really bad temperature and fever. So yeah, it's definitely the worst I've ever felt with anything.
And from the beginning, when you started with a cough and to the point where you were on the sofa, couldn't get up, did you at any point think that you had COVID-19?
Yeah, I think you don't believe that you can have it, and it's just sort of normal flu, and you don't want to have it, and you don't believe. I commute in and out of London, so there's every opportunity you could have picked it up, but it just felt like really bad flu, and just wouldn't believe in my head that I would have it or could have it.
That's a real problem, isn't it? Is that most people just don't think it'll happen to them.
No, absolutely. I was still going to work at the time. It wasn't as stringent with the guidelines and the focus. So it was more a focus if you've been to China or been in contact with someone, you should stay at home. So I was still going to work. I was still pushing through it, trying to do everyday jobs to the point when then I just physically couldn't.
And you hadn't travelled at all, had you?
No, not at all. I work in central London, but that's as far as I'd been away.
OK, so now you're on the sofa, you can barely get up, you feel awful. What happened then?
So my wife was keeping an eye on my family. They were very sort of, well, luckily for me, my parents sent me a little pulse ox machine because they thought, well, he's really, really poorly. The thing that you put on your finger. And it kept bleeping, alarming. So then we thought, well...
What does it measure? Sorry to jump in. What does it measure?
Measures your pulse and your oxygen levels.
Okay.
And the little pamphlet says it should be around 96, and it was coming up as 88, which a bit of self-Googling said that wasn't good. And then the guideline was to we'll ring 111. We were on the phone for 2 hours and still couldn't get through. And then it got to the point where it was getting so bad and I wasn't really responding very well. My wife decided that she had to call an ambulance. She had to call 999. And then within an hour, I was in the back of an ambulance and headed to hospital.
Do you remember all of this?
Everything sort of blurs. I remember very sort of certain conversations and not other things. All I wanted to do was sleep. I said to my wife as she was calling, I said, I just want another hour in bed. It just seemed very dramatic. But everything sort of blurs in and out. But you remember some of the harsher conversations, yeah.
OK, so you're in the ambulance. What next?
So the blue lights are on and you're not really talking much. And then I ended up I remember it felt like going through a back door at the hospital, and then you're taken into an isolation room, and two guys came in, and it was like something out of a movie. They had sort of big ventilator hazmat suits on with like a ventilator pack on the back. They took swabs straight away. They got heart monitors on, and just became increasingly concerned and just sort of checking me over.
Matt, that must have been absolutely terrifying.
Yeah, the other thing was, as this was progressing, the pain started to go away, which I've suddenly found out is to do with when you get more hypoxic. But the weird thing is that a sense of calm comes at the same time, which obviously is a bad thing now, I know. But yeah, you've got no family with you. You don't know what's going on. No one can explain to you. You can't hear people properly because they're talking through masks. So yeah, it was very, very terrifying. What
happened to your wife and your kids?
They were just told that they couldn't come in the ambulance, and they were sort of just left. We tried to, as I was getting sort of carted out the front door, try and make it as not nice, but as pleasurable for the little one as possible. Not to make a drama. She's only 8 years old and can't really comprehend what's going on. But yeah, speaking to Mel, my wife, afterwards, she just said it's just completely surreal and like a dream.
So when were you admitted? When was that?
So that's I think Thursday last week. Thursday
Last week.
Yeah.
Okay. So then, what happened then?
So the most vivid of the conversation is the intensive care doctors come in.
So you were in intensive care at that point. You went straight into isolation in ICU.
Yeah. So they take you up to this sort of ward. You're in a room. You're hooked up to every machine. You can hear every alarm and bell going off. But they come and have a conversation with you to basically say that the next step, that my lung had collapsed and was failing. My other lung wasn't doing great at all. And with everything that was going on and my symptoms, the next stage was to put you on a ventilator. But they're very sort of adamant that this is for support, not treatment. That they're going to do their best. It'll give your lungs a chance to hopefully repair. But they were quite clear that this was for support. And I think that was the most terrifying part, that there's no real treatment for it. There's no medication. You're just expecting them to just put a nice IV in and a drug and make everything better.
So then to be put on the ventilator, you have to be sedated, don't you?
Yeah. And I did sort of make a pact, and that was the start of the strong will of just saying that if I pass out and get really, really bad, but I don't want to go on voluntarily, I want to stay awake. I want to do everything that I can to sort of stay awake and to fight it.
So do you remember being on that ventilator?
So I didn't actually have to go on the ventilator in the end. They put every different type of breathing apparatus and changed it around. So you had a nasal cannula, which forced, like a robotic one, which forced sort of oxygen into you at like the highest level that it could.
Neutralizing the pressure in the lungs, right? Yeah,
it's sort of the closest step to the ventilator. So, and it sort of burns all your inside of your nostrils, and you're getting nosebleeds and everything with it. But it was forcing it in. You could feel it having an effect. The deepest breath you could physically take was almost like a really strong sniff, and that was it. Nothing would inflate.
Okay, Matt. Fast forward to when you start to get better.
Yeah, it's a very weird thing, because you're exhausted because you don't want to sleep, but you're sort of passing in and out, but you suddenly you just feel amazing. You things start to work properly. You can feel everything switching back on. You feel more with it, and you can start taking sort of breaths. The nurses, who were absolutely fantastic, who were literally the lifesavers, were teaching you how to breathe again and getting that airflow going. But the sense of relief, and you can start feeling the baby steps of getting better.
Well, it's remarkable that you're sitting here now talking to us.
Yeah, you can't believe it yourself, and there's no rhyme or reason. For every doctor and nurse that's been to talk to me, your body just kicks in. There should be no reason I should be sat talking. That'd have been it, but for whatever reason, everything kicked in at the right time and worked. So you get a little bit cocky, and I can manage to walk from the sofa over to a chair now and walk around the front room, but that's about it without getting out of breath. But you feel it's night and day now.
Okay, Matt, what was it like with the other patients? I understand everyone's alone there. They don't have their families with them. What was that like? Yeah,
that was the heartbreaking bit. It was like being in a film. You can't really comprehend it. They put these laminated roses on people's doors to indicate whether you've got the COVID virus or not, because the tests still take quite a few days to come back. But there was a guy opposite, and their family had come day by day. They could come up to the glass one at a time, and that was it. That guy lasted probably 2 to 3 days and didn't make it. So you were sort of in this fish tank, and then you'd see all the ICU guys come up and sort of start measuring up through the window and checking all your stats from a distance. But you'd see patient after patient getting wheeled past the window. But that was when it became quite apparent. It wasn't sort of elderly 80, 90-year-olds. These were young kids. These were people same age as me. There was no distinct creed or colour for anyone coming past the window. It wasn't. Yeah.
Okay, Matt, thank you so much. Thank you so much for talking to us.
No, thank you very much.